Welcome everyone in chapter Handling Imprinting Blood Donor Tissue Biopsy. Lab infiltration, cutting and small biopsies, renal, intestinal, skin, muscle biopsies, and identification of tissue blocking. The handling imprinting drainage tissue by biopsy and the imprinting tissue biopsy can record careful pigment technician prevent the tissue loss of proper organization diagnosis revelation. The biopsy bag of pre-emptying agar gel followed by careful organization insert the tissue on the one of the plane. A proper fixation typical to 24 hours, 8 to 24 hours is crucial before the emptying avoiding outcome. They include in according labeling, rabbit fixation and carefully cutting of essential to prevent the tissue loss of autolysis diagnosis error. The neatly sampled declined requirement specifically handling to row maintenance intent creative. Labeling and documentation. The patent identification, unwork tracking, reconstruction farming, multiple side. Then labeling for point of identification patient DOB hospital member of specific anatomical. The number of should be assignment pigment tracking through all processing date. Document of submitted documentation, multiple side of location must be placed separately, clearly liability content there. The fixation small biospace, place of picking immediately after removal identified within hour. The standard natural buffer formulation, fixed volume of must be to 20 time of volume in the tissue. A small generally recommend of hours of fixation. Alternative media, electroscopic copy use of pyromethyl aldehyde. Handling and cutting the small biopsies be sectored by fixtures deflected handle and other improved organization. So the processing aid lens pair message let back prevent a small pigment of the loss of processors. The endoscopic biopsy organ tissue must be immediately careful before the placing of formalin. The cross and cutting tissue particular will handle the declared lamp node and biopsy. Avoiding biopsy bad artifact. Pigment there are activated through the tissue. Renal kidney biopsy. A producer pre-coded through the canap ultrasound CD. Doctor insert the neatly the kidney under the location anesthetic. The patient should play in the much transplanted kidney in the bag. Recovery patient generally leave our producer monitor to labeling. Minor bleeding the common, rarely several bleeding the requirement transfusion. Two type of kidney biopsy and pre-protein kidney biopsy. Most of country neatly insert the skin into the kidney, often with an ultrasound or CD imaging guide of the neatly. Open biopsy will perform the alternative undergoing another operation if the method of is not possible. The biopsy procedure usually done are patient based and around the 30 to 20 minutes. Common kidney disease diagnosis biopsy, the condition, key biopsy find in the treatment of implication, the minimal change of disease of protophonic and triad, lupus nephritis, immunocomplex of triad immunopresent. IgA nephropathy, IgA deposit mechanism, the blood pressure control immunosurveillance and actual tubular nucleus, tubular cell damage, supported care of our nephrotoxic tract. The kidney transplantation rejection, the inflammation cell, artery, tubular adjusted immunosuppression. The intestinal biopsy after a small bowel are typically performed endoscopy, upper endoscopic colonoscopy. The sample tissue in the digestion tract. The diagnostic condition clearly disease, organ disease, infection, inflammation. Producer flagell light of camera, cutting tool the insert through the mouth, endoscopic and colonoscopic. Preparation, the insert about food and drink, cerebral biochemical diseases suspected, between eating the protein. Situation, mainly the typically administration of comfortably. Endoscopy internet. The camera endoscope is mouth down the scope isopac your stomach into the first part of the small intestine duodenum. Sample instrument is based off to small painless sample intestinal lean. Recovery producer 20 to 20 and typically from the day. Confirmed disease. The checking damages filtration will lay finger and projection of observed nutrient. Diagnosis inflammation bowel disease IBD help in identifying chronic disease. Identify infection reverse bacteria, virus, parasite. Symptoms investigated chronic unexplained weight of class cervical nutrient deficiency. So biopsy removal small section or layers of skin. Epidermic of dermis thickest usually the knitted the procedure. Punch biopsy. The small section of skin included deeper layer included two layers called the epidermis. Dermis at the top layer fat under the skin. External biopsy used the removal encourage lumps or area irregular skin. Might include the border calcium skin where skin deeper layer you may need satisfaction close mold. Skin biopsy. This is Campbell, punch hole and punch biopsy. Healthcare professional of actin, carotid, plaque, skin disorder, skin cancer, skin leg, ocular mold of other growth. Handle the removal the trigger the wood care step. You are a healthcare professional if it can be applied rapidly into the towel. The infection conduct healthcare team in the infection include the fever kill, increase the pain and travel the pain of the biopsy side. Muscle biopsy. The procedure performed outbound biopsy section of skin, upper arm removal small piece of muscle tissue. Sometimes performed a peculiar biopsy neatly, open the biopsy area turned to dead. General information pathology analysis, sample estimation, light microscopy, influorescence, electron microscopy, preparation patient can be top blood thinner and fasting before procedure. Result typical type of food data to retain. The muscle biopsy sample tissue inclusion cat and skeletal muscles. The cells are prevented muscle symptom myopathy like muscle weakness and need the more than definitive diagnosis. Myotonic complex autoimmune disorder with antibiotic disorder neuromuscular connection. Problem to communicate the muscles. Escape your eye, mouth and limbs. Polymyositis chronic disease involving skeletal muscles. Dermatomes. Inflammation skin, muscles and subcutaneous tissue often the result in weakened. Amyotrophic lateral skeletal. Also the low AL disease attacks nerves voluntary muscle movement event. The inherited genetic disorder involving balance and coordination. Trichinosis parasite that live in the mate. Symptoms include the muscle pain, but muscle biopsy rarely down to the diagnostic trichinosis. Coordination to black, proper black organization essential for high quality cytology session. Ensure all tissue layer presentation visibly under the microscope. Second are edge wave layer. The tissue organ embedding critical process in placing the tissue pigment into the mold, filled the molten paraffin. The paper organ presentation scratch the second tissue surface plates under the intermold. Include the structure against the embedding tissue with the edge fascination of tissue densified. Key organization guidelines: the skin pigment, tubular structure, luminous, multiple piece, organ considered augmented. The epidermal surface of slider mold, epidermal cross-section inquiry all layer well or visibly, tissue row uniform cutting, the plate pigment bottom of the ensure the clean the first cut. The diagram may be multiple tissue black. In between process of workflow, preparation run of the paraffin dispenser and cold plant organization paraffin mold is classified. Dispenser mold of amended paraffin mold is the correct organization ensure the fat. Cold plant are free solid bottom anchoring tissue plates. The corresponding tissue cast the top of mold fill the completely paraffin. Finally, certification they completely fold a plate approximation 30 minutes. The common Fitafil's fermentation. Incorrect organic place in angle upside down prevent the property critical area. Bore empty not of bone lead of cut certain the damage of black. Leg of our structure maintenance of multi-tissue black micro hard dissection. Properly oriented black prevent the need recutting shaving but time of pigment intricate.